it's Dr. Smith again. We've talked about the medications that may not be the best solution to handling heartburn, reflux, or GERD in the long run. We've also talked about why these symptoms happen and natural solutions to handling them. But why does this problem happen in the first place? What happens that causes your stomach to produce less acid, allowing the esophageal sphincter to open and allow the food and or acid to escape into the esophagus and cause these symptoms? Now, surprisingly, I've heard people talk about, well, I've got a hiatal hernia, and that can be a factor as well. But surprisingly, the most common cause is a bacterial infection. The infection is by a bacteria called Helicobacter pylori, or H. pylori as it's commonly known. Now, this H. pylori infection is extremely common. It's estimated that 50% of the people in the entire world have this infection. In the United States, depending on your age, it ranges anywhere from 20% to 50% chance that you have this infection. Now, H. pylori causes the decrease in stomach acid because it infects the lining of the stomach. And even though it loves the lining of the stomach, it does not love the extreme acid environment that the stomach produces. So what happens is it gets its way into the parietal cells of the stomach and causes them to produce less acid than they normally would. Now, this is good for the bacteria, but like we said before, it's absolutely not good for your digestion and for your absorption of nutrients. And it also causes the symptoms of reflux or heartburn. So how do you know if you have this bacterial infection? You could do a blood test. That's the most common way doctors check for it. To be honest with you, I don't think that's very effective because the blood test checks for antibodies. And if you have this infection or have had it in the past, you'll show up as positive. That's fine. But the test will not tell you if you currently have this infection or if you had it a long time ago and you fixed it in the past. The best way to test for this bacteria is something called a urea breath test. What you do is you go to the laboratory, they have you breathe into a baggie, blow it up like a balloon, they close it off and put it aside. Then they have you drink a solution that contains a sugar that these bacteria absolutely love. You wait a little while, anywhere from 15 minutes to a half an hour, then they have you blow into another baggie, seal it up. If you have this infection and the bacteria have digested that sugar, you will give off higher amounts of a urea gas when you breathe out. So when the lab tests the before and after baggie, it'll tell you, gee, there's an awful lot of urea gas here, you must have H. pylori. That's the best way to do it because it tells you if the infection is active. And also, after you undergo treatment, whether it's antibiotic treatment or natural treatment, you redo the test, and if there's no urea gas in that second baggie, you know you've gotten rid of the infection. You can't do that with the blood test because even if the infection is gone, you'll still have the antibodies. So you've determined you have this H. pylori infection that's causing your reflux. How do you get rid of it? There's basically two methods. You can undergo antibiotic treatment for a couple of weeks, or if you choose a more natural approach, you're going to take an herbal combination of different herbs for about a month. Both can be effective. I often try the herbal approach first. If that doesn't work, and in some cases it doesn't, most it does, then I'll recommend that the patient speak to their medical doctor about the antibiotic approach. Now, the thing is, if you have this infection, I really recommend that you get all your other family members tested or at least undergo the natural treatment for a month or so, because this infection is highly contagious. And a lot of times people will do all the right things. They'll take the antibiotics or they'll take the natural approach and they can't seem to shake it, and it's because they're being reinfected by other family members, by a kiss on the lips, sharing a spoon, things like that. It's that infectious. So I hope this series of videos help you learn more about the causes of reflux and heartburn and how to handle the symptoms, and also how to handle the cause of the problem as well, because that's the best way to treat anything. Fix the cause, not just address the symptoms. So if you found these series of videos the least bit helpful, please like these videos and also share them to anyone you think might help. Thanks for watching.